I will be moderating our first panel discussion titled Reforming Tribal Health Data Infrastructure. So this panel will discuss how the design of data systems, practices, and infrastructure have created barriers to tribal public health practice. So we'll be hearing from 3 presentations, followed by a Q&A with the panelists. Our first panel presentation will be by Isabel Algrant and Sandra Mitrovic. Isabel is the Assistant Director of Training and Technical Assistance at Actionable Intelligence for Social Policy. Sandra Mitrovic, who is Time and Yamani Maidu, serves as Civic Engagement Consultant at the Native American Rights Fund. So please join me in welcoming Isabel and Sandra.
Awesome. Hello, everyone. I just want to make sure that y'all can hear me. I try not to lean into the mic too much. My 2 disclaimers are that I am a theater kid and a former middle school teacher, so you can look forward to all of that fun or nightmare, whatever, take your pick. I'm Isabel. I'm the Assistant Director of Training and Technical Assistance at ASP. Sandra is going to come up next. We're trying to preserve some space here. Interesting. Okay. We're starting a little bit. I feel like a little out of order potentially. It's fine. We don't need, we're gonna keep it rolling. So our work at AASP is really about centering racial equity. However, tribal indigenous data sovereignty is a huge part of that process. So we actually just on Friday published a new toolkit for centering racial equity that has a chapter on tribal data sovereignty, which Sandra's gonna get into more of the specifics of as part of our work group on that. But why racial equity and data integration? This panel is specifically about data infrastructure, so I'll start there. Racial equity is the process of eliminating racial disparities and improving outcomes for everyone. It is the intentional and continual practice of changing policies, practices, systems, and structures by prioritizing measurable change in the lives of Black, Indigenous, and people of color. This is Race Forward's definition, and we like it for a number of reasons, but a big one is that it's about process, right? Racial equity is a process. It is an ongoing movement. And data infrastructure is the systems, technologies, and processes for using, storing, securing, and interpreting data. This includes hardware, software, and organizational practices. I've bolded organizational practices because that's really the work that we do. I'm not a technologist. I can speak to you very little about hardware or software, but I can tell you a lot about what practices we can employ to center racial equity in our data infrastructure and the work that we do. So let's address the elephant in the room. You might notice I have elephants on all of my slides. That's a middle school teacher tactic. Have a fun scavenger hunt there. The hunt for more data is often a barrier for acting on what we already know. This is from Ruha Benjamin's Race After Technology. It's very easy to use data as a barrier, right? As an excuse, as a means of stalling. I think we see that data is often imperfect and we should be really intentional about the data that we collect. I know we are living in an interesting moment and we should be intentional about the data that we document, right? We want to be protecting people. So to address the elephant in the room, using administrative and public sector data, which is the core of our work at AASP, can be incredibly beneficial, but it can also be, it can be an excuse, it can be harmful. And as we're using it, if we're trying to use it ethically, we need to be thinking about the role of racial equity, right? Data is biased because society is biased. We're going to see people of color, especially Black and Indigenous people, overrepresented in administrative government data because they've been made reliant on those services. There are a lot of words that we use that sort of sterilize this very messy and long-standing issue, right? We think about disproportionate contact with law enforcement. We think about achievement gaps in education, right? Those are well-meaning phrases. They are meaningful, but they're not actually naming the issue, right? Which is that what we know is that there have been centuries of oppression and systemic poverty put upon these people, again, especially Black and Indigenous people in this country. And so if we are going to be using that data, we need to think about where it is coming from and what has led to it being the case, right? And as we're using it, we need to use it according to having that. So that is sort of the elephant in the room. So we think about this on 3 levels, the micro, meso, and macro, right? The macro level is sort of where we all want to be, right? We would love to be dismantling systems of power. However, a lot of the work that we focus on at AASP is very personal and individual. We have to think about who we are and how we are approaching data and what we see in that data. And once we reckon with that, we can reckon with it in our organizations, right at the meso level, thinking about the ways that we're working and the people that we're working with. And then finally, we can sort of elevate that to the macro and really question and dismantle those systems of power that have put us here in the first place. So when I'm talking about an integrated data system, what does that mean? A couple people earlier have mentioned sort of the tribal practices of seeing people as whole people, communities as whole communities. An integrated data system is also kind of like that, right? The benefits of it is that we can see people as whole people who interact with systems in different ways, right? We can see the whole person, we can see a whole family. Importantly, we can even see people longitudinally, right? Where have interventions happened and how has that impacted their outcomes? We do know that people of color tend to have worse outcomes in human service intervention systems, right? That is a data point. That's something that an integrated data system can tell you. There are like a number of lovely bullet points on this slide. I won't read you all of them, but I will say that we are really people. Technology is a great tool for integrating data, but the people work is what has to come first. This is a lot about building trust. And the last point here is governance. We are governance people, right? What are we using this integrated data for? And who decides when there is a good use of that data? This is incredibly important in the tribal context, right? We should always be, when using and thinking about tribal and indigenous data, which can exist any and everywhere. I know it's very easy to think about it in reservations and where people tend to be tribal affiliated, but people of indigenous descent live everywhere, and we do need to think about their needs as we are working with data wherever we are, and in integrated data, it's no different. So how do we bring them into our governance processes and make sure that we are making results that are meaningful and useful to them, and also that they have consent in the research agendas that we're using them for? So at AASP, in case you haven't heard of us, we are data evangelists. We are not data holders, right? We are here to be supportive of data sharing efforts and thinking about how do we bring community in and do governance work, legal work, and other linkage work while centering community. We are focused on the ethical use of data for policy change, right? Ideally, we are not doing research for research's sake. This is all going back into the community to think about, to quote somebody from earlier, right? The file is the human spirit, right? We think about the person behind every data point. Who are they and what do they need? Because they are giving something to us, right? They're giving us their information. That's very important. How do we give that back to them? So at AASP, if we think about this smoothie as like useful data with insights that can drive change, there's sort of analysis, which is a thing that we all love to think about, right? It's kind of the fun part of data work. Then there's this kale. The kale is governance and legal and cleaning and standardizing. This is not necessarily like the fun, sexy work of data work, but that is what we do here at AASP, right? Because it's incredibly important to get usable insights, even if it's not the most obvious or the thing that people point to. Okay, so when we think about data collection, access, integration, or use, we like to think about it in 4 questions. Is it legal? Is our lowest bar? Generally, a lawyer will have to answer that question, a privacy officer potentially. If it's legal, that's great. That doesn't mean you should do it. But that's a great place to start. Is it ethical? We like to think about, is it ethical as sort of a risk-benefit matrix. I have a couple of examples here for y'all. Again, these slides will be available after. Feel free to take pictures. This is also in our toolkit, which is available online for free. Yay. But a risk-benefit matrix, right? If something is low risk and high benefit, that's a fantastic project. That's something that we should be doing. If something is low benefit and high risk, that's probably something we don't need to be doing, right? There's no ethical reason to proceed with data sharing, and we are putting a lot of people at risk in the process. Is it a good idea? This is where things get a little bit hairy. There's not always a clear answer. Sometimes things are legal and they're ethical, but they're not a good idea. Generally, this comes from them being impractical, right? Are we doing research on an area that could potentially help people, but nobody has the resources to do that work? Maybe it's not a good idea, right? What are we doing that for? And finally, how do we know and who decides? This is all about governance, right? Who is making those decisions? How do we make those decisions transparent? And how do we include people who are involved, who are represented in the data in making those decisions and setting that agenda? So I mentioned a couple times our toolkit for centering racial equity throughout data integration and the data lifecycle. This is basically a process slide to say that while our first version of the toolkit came out in 2020, which was after 3 years of work, our second version of the toolkit just came out on Friday. That is nearly 8 years of work. Not to reverse date myself, but they have been working on this since I was literally in high school. So this is like a very long process with nearly, and I believe at this point, over 100 people involved. So we have brought in examples from across the United States. A couple of them are actually sitting in this room, which is super thrilling. Our toolkit has positive and problematic practices for working with data across the data lifecycle. We also have works in action. I will say that we don't call them exemplars, we call them works in action, because a lot of the people doing this work are saying, we're not done yet. What are you talking about? This isn't as good as it could be. And we think that's fantastic. And it's very rooted in humility. So our works in action are reflective of that process. These are people who are doing great work on the ground right now and starting where they are and working toward equity. We have 55 examples in this toolkit, which we're very proud of. And finally, it comes with a companion workbook, which is a great place to start for you and your partners as you're thinking about data projects. It is a Google Slide document. You can duplicate it, you can use it, do it with your partners. It's a great place to start, and it's a new companion piece to the toolkit that just came out. Okay, that was a marathon, and I tried to go very quickly to save Sandra as much time as possible, so I'm going to pass it over to her. Thank you all so much.
Sure, it's this forward. Oh, let's go back. Let's see where we are here. Slides are a little bit out of, sorry. Oh, well, geez. Hold on, let me go back. Apologies, everybody. So I'll just jump right in as I get us back to foundations for working with tribal data. But one of the things that was really important and exciting for us to talk about as we were working together as a group, and I want to just go back to that as we have kind of talked about in the room, communities, right? Coalitions. This work didn't happen right in a vacuum. I think I joined a couple years ago working with this group and thinking about how tribal nations have that right, our inherent right to govern ourselves and our data and how that can be controlled. We already heard about that, the framing of that, which I think was super important for our first presentation, was talking about how we frame that in terms of storytelling. So one of the things we really dove into with our working groups was really just thinking through those definitions. We hear about tribal data sovereignty, that's been coined phrase indigenous data sovereignty, and what does that look like as a collective? Some of the things that we talked about within our groups was that government to government relationship, how we're working within community, what that looks like. My background in higher education, and I shared this story often, was how we were working with research and IRBs. Somebody already talked about IRBs and tribal codes and what that kind of collective ownership of that data looks like. It's not just one simple thing of going to, as many of us know, tribal council or legal within tribes. It's also thinking about, as someone mentioned earlier, how is our elder population in the community receiving it? How are they participating? How are our youth participating? What does that look like? When we talk about the collection practices too, in terms of research codes, I really, as a grad student, I would say, thinking about this in terms of community involvement, I really took it back to kind of that ethical consideration of what that looks like in the community. And one of the example cases I used in the work group is I talked about how do we do that when you have a tribe that doesn't have a tribal IRB? How do you do that when you're going back in and maybe doing resolutions with your tribal councils to be able to set that up and research codes, and how do we help them through that process? And so that's something our working group really talked about, that idea of effective consultation. We always hear consultation. I worked in policy for quite a bit now, and one of the things that we're constantly hearing all the time is, well, effective and meaningful consultation. And we talk about what that looks like, but also the fact that that has to be defined by the tribal nation of what that consultation looks like. We can have a coin phrase, but if the tribal nation hasn't bought into that, as we all know in this room, that's something we have to continue to go back to. That data life cycle that you see up on screen that we talk about in each phase, really coming back, we heard it earlier today, but didn't quite say, are you willing to pivot? We talked about it may be legal, maybe something you want to do, but are you willing to pivot during any part of that data life cycle? And you have to be, because you may come to a point where, as somebody mentioned earlier, someone in the community brings up, hey, this was really great in concept. This was something we really want to do. This is something we're planning to do. And there may even be funding tied to it, right? But is it still a good idea? What are the consequences of doing this? And so some of the things that we talk about in planning is really being able to pivot. We do have, and I don't have enough time, but we do have a couple case examples that I want to just make sure when you go back through the slides that you hopefully get a chance to look at. And one of those was Minnesota, the MMIR office. When you're talking about coalition and community intervention strategy, and doing that research, surveying different people. Their final report led to the creation of a specific task force and relations group. And I think those are also something we're thinking about: action items, next steps. How are we also helping provide best case in terms of testimony making? We see that a lot too in our survey, not just about surveying, but also part of that process of that work in action. I want to make sure I leave enough time for this last slide for a timekeeper. Thank you. But I want to work through making sure people, when you're looking at this workbook or this toolkit or any toolkit, the data collection part, the data access piece, those work in action case examples, but also the reporting and dissemination. One of the things that we are always talking about as it relates to the reporting is always coming back to the table. I know sometimes for researchers, this is really hard to do. You get this wonderful report, you've contextualized all these results, but we're always going back to that, again, ethical development, reporting. Maybe it might come back to, and we have a couple of, again, I'll point you to when you get to the PowerPoint to look up both the First Nations and Indigenous community cases about how they were able to kind of go in, look at those different community interventions. The first one, First Nations example, for example, on the reporting and dissemination for Mohawk Nation, they were actually able to go back in and create those community interventions when they went back to some of how they were looking at reporting and dissemination. So I know I had to get through this pretty quickly, but one of the biggest takeaways, I'll just say, as a data owner, data steward, somebody myself who works in community, works in policy, is we're constantly looking at how do these stories, collective stories, come together? How do we use the data to tell that story? But then also, how do we center that back into community to make sure that the data stewards really that are taking part are from community. So I'm excited that we have this new updated toolkit. I hope people get a chance to look through it and use it after this session. And when it comes to Q&A, I know Isabel's gonna take some of those. So thank you.
Thank you, Isabel and Sandra. Our next presentation will be from Jessica Perfett and Gretchen Martin from the National Center for Fatality Review and Prevention. Jessica is from the Cherokee Tribe of Northeast Alabama and serves as the tribal liaison at the center. And presenting with her is Gretchen Martin, Technical Assistance Manager for Child Death Review and Fetal and Infant Mortality Review. So please welcome Jessica and Gretchen.
Hello, everybody. Like she said, my name is Jess Perfett, and I am Cherokee, and I'm here today to talk to you from the National Center for Fatality Review and Prevention. Just real quick, by show of hands, who is familiar with the National Center? Do you have anybody in the room? Couple? Okay, I got a couple over there. That's great. I'm glad I'm here today, and I'm very thankful to be here. But today, I want to start off by acknowledging our key funding partner. We're funded by the Health Resources and Service Administration, and I do want to let you know that the content for today's presentation is based on the author and not to be construed by that of the federal government. It's a slide we have to say, right? So about the National Center, since not too many people in this room are familiar with who we are, these are a list of a couple of the core functions. We are based out of Michigan Public Health Institute, and we're a nonprofit organization providing a lot of technical assistance and resources to child fatality, fetal and infant mortality review teams across the state. Kind of what we do is a lot of communication among fatality review teams. That can include listservs, different webinars and trainings that we do. We provide those technical assistance free of cost to anybody involved in fatality review through those trainings, meeting them where they are. We also develop actionable resources. There's tons and tons of them on our webpage, and we're always developing new ones based on new information that comes up. And then I'll get into it a little bit later, but we have the National Fatality Review Case Reporting System, which I'll refer to it as just our case reporting system. There's two goals I have for today's presentation. The first is going to be talking about data sovereignty, looking at the challenges and opportunities that we have, and then looking at fostering partnerships where we can talk about shared data systems, tribally led fatality review, and some funding opportunity. So what is fatality review? It's a multidisciplinary process where a bunch of different professionals, community members, parents involved in fatality review really come around the table and just give life to the child or fetal infant that had passed away, and just having a conversation and looking at it from, a 35,000-foot view of what happened with that child's death and kind of what the community can do to come together to prevent future ones from happening in the future. It's also a really great opportunity for professional debriefment. A lot of times we're working in different silos where, like, maybe medical examiners or providers or law enforcement, they're not talking to each other around the table on the same case. That really for this can talk about, that debriefing opportunity that you might not get. You might just be doing your part in that case and then just moving on, and that's kind of the end of it. So it's really nice to see from a public health lens, getting these people around the table to talk about it. There's also an opportunity for looking at quality improvement. Fatality review is not to place blame on the victim, the family, anything involved with that. It's really to look at what happened, why, and what we can do to prevent that from happening in the future. It also is a great way for looking at those risk and protective factors that I'll get into a little bit later. So you might have heard before of different types of reviews. This is a little visual and very visual person of different fatality reviews that can be from adult fatality, suicide, overdose, maternal, and then also child fatality. The ones with the gold star on these slides, as you can see, are the ones that the National Center helps guide. So we have our suicide, fetal and infant or femur mortality review, and then our child death review. So how does it work? In a nutshell, in an elevator pitch is, ultimately it comes from that identification. So looking at which cases are going to be met by criteria, bringing that case to a review happens after all of those records are collected or information surrounding that child and brought to that review, where then it can really be a deep dive conversation of looking at that child's life, looking at the community, looking at everything that went into it, and coming up with some recommendations to help aid policy change, and then ultimately putting those recommendations into action, right? You don't want to just come up with great ideas and then leave the table and that's it. You want to make sure that these are becoming actionable and helping prevent tragedies in the future. So child death review is in all 50 states, including the District of Columbia, where we are, Guam, Puerto Rico, and the US Virgin Islands. Reviews can happen really based on individual needs. So they happen at the state level, they happen at the local level, they can happen at both. So there may be more than one review team in each state, and a lot of times that there is. So what is FEMUR? FEMUR and infant mortality review is very similar to child death review. One of the main differences is the community action teams that are around that table and the storytelling aspect. Community action teams are the ones who will learn about like what prevention recommendations were developed during that review, and then they can take that and really put it into action and drive their community into just a really positive direction forward. This is a FEMUR profile survey, which is located on our website. The little dots represent all of the different FEMUR teams. As you can see, some states have a lot of FEMUR teams and some don't have FEMUR teams at all. This is updated regularly if you're curious about what FEMUR teams are happening in your state or jurisdiction. So our case reporting system, right now, this was created back in 2005 by the National Center. It is a web-based data set where the report form has over 2,500 variables that data can be inputted into for our case reporting system. There's always paper copy versions as well, but this is a digital form used to capture all of the data, including demographic information, risk and protective factors, cause and manner, prevention opportunities, and those involved in the actual review. But this case reporting system is updated really frequently based on information and input that is received from the field. So if there's information that's missing, all of that is tracked through the voices that we're hearing in the community as reviews are going. So since 2005, it's grown exponentially into what it is today. Back in 2018 is when FEMUR was added into the case reporting form, and now captures a lot of that data. And then we're currently working on an adult version of the case reporting system for suicides as well. Right now, there's 48 states that are using the case reporting system, and there are 20 that are using that case reporting system specifically for FEMURs. The states that aren't on there right now, it's not because they aren't wanting to or willing to participate in the utilization of this. It may be because of the Superfund contract process involved with that, data sharing agreements, or maybe legislative or funding opportunities that just aren't quite there yet. But conversations are happening with all 50 for utilization. So one of the main questions we get and working on towards now is why tribes should engage in fatality review. We strongly believe that Native voices need to be heard in fatality review, so because they're the best advocates for their community, right? Including those voices around the table of current reviews or having tribally led fatality reviews is going to help bring a bigger, clearer picture of what's happening in the community based by those who know it best. There's also a lot around the cultural relevance that's looking at the beliefs and practices which vary across the different tribes in our nation. There's also capacity building where it can help just shape the growing of what the need is based on those individual needs, and also the sovereignty and jurisdiction that really align with like the tribal frameworks of the area and allowing tribes to own control over their data and protections on how it is used, which I'll get into that just a little bit more here in a minute. So right now there's state and national efforts that are being done at the national level. It's advocating for the policies and prioritizing that tribal sovereignty for the data governments. And then at the state level, it's the technical assistance that's provided through the National Center that can help engage the community in their partnerships. So it's not only engaging who is in the community, but maybe at a national level too, is bringing in some national partners or community partners that can help with that facilitation. We're also really engaged in meeting tribes where they are. It's very individualized. You know, everyone's a little bit different. I know we've talked about data suppression in small numbers, but really meeting where you are through like a secure and collaborative process. The National Center is also really charged right now with tribally led fatality review. That's something that we're working on to equip tribes to do this how they see is fit best, equipped to use a data system that's unique to their needs and align with their priorities. We are also working on the case reporting system to really integrate questions that might be relevant to tribes or that tribal community specifically. And we really believe that in this case reporting system, tribes have the ability and control on how their data is used, how it's stored, and how it's accessed. As we all are very aware of the challenges in this room, I always want to point out, you know, there's a lot of historical mistrust. There's a lot of silos in the data, ownership concerns and things that we see when accessing the data, especially when it comes to who can access the data and how it's shared. But here at the National Center, we definitely prioritize that it is up to the tribe on how that data is going to be shared, how it's going to be used, how that data use agreement is going to come into play. It's not something that we as a National Center are telling how it needs to be used. It's actually the other way around of how is this going to help you and how do you want your data stored, analyzed, and used. It's not ever used without permission. So right now there is a funding opportunity. I know it's hard to do a lot of work when you're asking people to do it for free. So we have a capacity building funding for tribes to engage in fatality reviews that are tribally led, or if there's an opportunity for tribes or tribal community members and tribal voices to be included in current CDR and FEMA reviews that are being done. Don't worry, the application process is extremely simple. We don't like paperwork either. It's a couple of questions that we're asking to gather what the capacity building opportunity might be, and really leaving it up to the tribe of what that can look like and what the needs are. It's on a first come, first served basis, and there's no ceiling or floor to this as of right now. But right now we are proposing that this time frame for the application, just email us for more information. It's, like I said, a very easy application, but we are here to support funds to engage in this type of work based on what your individual needs are. We do have some subset questions that could be helpful for guiding this application, but ultimately, like, we really do want to leave it up to being tribally led, and we firmly believe in that. So that is what this application is for. That is all I have for today. This QR code will take you directly to the National Center's website. You can always email me for more information, and I will leave time later for some questions with our panel. But thank you for letting me have this quick minute of presentation for you.
Thank you so much for that presentation. So our last speakers for this panel before we move into the Q&A discussion section will be Caitlin Guild and Elisa Garnanes. Caitlin is Manager of the Evaluation and Strategic Relationships at Mobile Health Map, and Elisa is Dean and Patient Registration and Benefits Specialist at Fort Defiance Indian Hospital Board Mobile Health Program. So please join me in welcoming Caitlin and Elisa.
Hello, everyone. Can you hear me okay? Perfect. Well, I'm Kate. I'm the Manager of Evaluation Strategic Relationships at Mobile Health Map, which is a program of Harvard Medical School. And I'm joined by,
I'm Elisa Garnanes, and I work with Fort Defiance Indian Hospital, and I'm with the Navajo tribe.
so today we're going to talk about one of the resources that Mobile Health Map offers free of charge to mobile health programs, and specifically our partnership with Fort Defiance to develop a dashboard that talks about their ROI and really just looking at sustainability for tribal mobile health programs. Sustainability is always timely, but I think right now is a very important piece of the work that we're doing in public health. So just quickly, some background on Mobile Health Map. Our mission is to help mobile programs measure and evaluate their impact. We do this by providing tools and resources like the one that we'll see today, the dashboard. We also collaborate with researchers and funders to really elevate the whole mobile health sector. And then we also share information with healthcare leaders as advocates for the mobile health sector and mobile health programs around the country. So this map is taken from our website. The orange dots all represent mobile health programs that exist in the United States. We currently have around 1,400 mobile programs as part of our network. We have about 8 programs that are tribal mobile health programs. We'd love to see more folks on there. It's free to join. And we estimate that there are around 3,000 mobile health programs in the United States. We're currently in a big push to identify all of them and support their work. So Lisa's going to share a little bit about the Fort Defiance program.
Okay. What we do is we have 2 mobile units that we work with, and we have a provider and a director. Or our director is our provider on board, and then we have 2 drivers, and we have 2 medical assistants, and me. And then also we just brought on a nurse case manager, and we're waiting for another provider to come on. What we do is we provide services to our patients to 16 communities on the Navajo reservation within our service unit. And we do family practice for about 3 to 4 days a week, because on that, every other Monday, we do teen clinic where we go to our local high school and provide services to them too. And then we also have elder clinic once a month. And I love this job. It's really amazing because what we do is we go out to the community in the rural area where patients are unable to get to. A lot of our patients, they don't have transportation. They have a hard time getting to places. And then also it's far from going from hospital, getting to a hospital. So we're trying to get people that are having a hard time getting into the hospital to come to see us. And it's like, I guess, like clinic on wheels. That's how I usually explain it to our patients. But we provide services with like a primary care clinic where we do diabetes screening, STI screening. And then we have our provider on board if they're sick or anything like that. We do COVID testing and then immunization also. We're really big on the COVID vaccine and then also the flu vaccine. And then there's other vaccines that we do. At our teen clinic, we're trying to get them back on. Since COVID, it kind of went down, but we're doing a lot of sports physical there at the hospital. And then with our elder clinic, we do where we usually go to senior citizen centers or the chapter houses. And then we help the elder population there. We usually bring a traditionalist there, physical therapy, and we do diabetes screening. What is it? Physical therapy, diabetes screening, or traditionalists. But yeah, but it's really great. But I enjoy working with the program.
Yeah, their program's really incredible. As you can see, they do a little bit of everything and are working really hard on the Navajo Nation. So there's growing evidence for mobile health on a national scale. However, it's still really important for programs to be able to evaluate their work and their impact. Even with the growing evidence base with these publications, there's still trouble with sustainability for a lot of mobile programs. So looking at some current barriers and current data infrastructure that Fort Defiance and other tribal mobile programs have expressed is really limited time and staff capacity, which limits the ability to collect data, but also analyze data and develop really strong, robust evaluations. Specific metrics that are required by funders and decision makers can limit the kind of data collection, but also can really place parameters on programs to come back with metrics that are incredibly difficult to identify. They are utilizing outdated and fragmented data systems, which make it difficult to utilize culturally relevant metrics and makes it hard to actually report real time on the impacts of their programs. And then lack of transparency and access to decision makers. Again, they might be collecting data for a grant or for a funding reason, and they might not know where that data is going, which again builds into this historical mistrust and lack of data sovereignty. So this quote is taken from the Case for Mobile, which we published in 2022, talking about the importance of having a business case for your mobile health program. And it says, when mobile clinic leaders show through data that the mobile clinic benefits the organization, decision makers will be more likely to support continued efforts. And really, this just talks about the importance of evaluation and being able to show your impact in different ways to different stakeholders. So we've talked about data, and we know data is really important. When it comes to evaluation and impact evaluation, it can help make decisions. It helps build this compelling business case. It enhances transparency and accountability, and then supports health equity ultimately. So the data challenges that we previously mentioned result in evaluation limitations with limited time and staff capacity. There's infrequent and incomplete analyses where critical insights might be missed or they might not be expressed. Specific metrics required by funders, again, creates this narrowed scope of evaluation, and it omits broader, more culturally relevant outcomes. And then lack of transparency makes evaluation efforts really siloed and limits the advocacy and ability for tribal mobile programs to really be involved in where their data goes and what the story they're telling. Outdated and fragmented data systems, again, just makes it difficult to do data analysis and to share data and tell your story. And then inadequate technical infrastructure leads to a less sophisticated analysis that might be needed and required by certain stakeholders like funders. So at Mobile Health Map, we've created this tool for mobile programs. And we find it specifically relevant for tribal mobile programs because of the privacy agreements and security agreements that we have. We'll show you Fort Defiance's dashboard, but really this is a national dashboard that aggregates data from programs that choose and opt into entering their data into our system. And this calculates the return on investment, life years saved, emergency department visits avoided, and dollars returned, which are huge metrics that a lot of funders are very interested in seeing when applying for grants. And on the bottom in the different colors, we show the different population demographic measures that are calculated. This is Fort Defiance's dashboard. So we can see that their work in 2023 saved 83 years of life. Returned about $6 million. They had around 2,000 visits. There was an 11-to-1 return on investment, and they avoided 430 emergency department visits. And so being able to quantify these metrics is just really helpful in funding and in pursuing support from boards, et cetera. So how do we calculate this data? And I just want to say this piece of data is just a small part of the work that we do with mobile programs and tribal mobile programs like Fort Defiance. We utilize the U.S. Preventive Task Force services in our algorithm. So these are the specific things that we're able to look at with our algorithm. But we look at very closely with each program, and with Fort Defiance, they're part of a national learning collaborative with us. And we are conducting a really comprehensive culturally relevant needs assessment, engaging tribal leaders and members of their community to better understand the needs of their program to develop a robust evaluation plan. So this tool, this dashboard, is just one piece of the puzzle. This slide just talks about how we calculate the metrics that we mentioned. So we utilize QALYs, which is a common metric used by public health researchers that incorporates years of life extension, intervention, and also the quality of life. And then dollars returned takes into account QALY and the value per statistical life year. Return on investment is the dollars returned divided by the annual operating costs of the program. And ED visits avoided looks at the percentage of visits that could have resulted in an emergency department visit and the average cost of an ED visit. So really, this allows Fort Defiance and other tribal mobile health programs to strengthen their data. It provides a free dashboard that enhances operations and sustainability. It allows them to track patient demographics. It takes data that they're already collecting, even if that data is collected with pen and paper. It's super easy to put that into our system to create this visual that can help with operations. Again, going back to grant writing, and especially right now, the importance of being able to show the impact of your program is going to become more and more important. So being able to utilize these data visualizations and high-level metrics in grant writing and report writing is going to be really valuable. And then it strengthens advocacy and policy efforts. We really want to empower tribal mobile health programs to utilize this data in a way that benefits them and to support their advocacy for the longevity and sustainability of their programming. So thank you very much.
Thank you.
So I'm going to invite our presenters to come back up to the stage here so we can move into the discussion section of our panel discussion here. As they're coming back up, can we give them another round for those excellent presentations? Yeah, Jessica's up here too. Yeah, thanks everyone. So we heard excellent presentations about several different types of data, looking at fatality review systems, administrative data, and then evaluation data, right? All very important, but really different types of those data systems and practices. So kind of to get us started in this discussion section, before we open it up to audience questions, I wanted to hear a little bit from each of you, kind of your thoughts about where data sovereignty fits into those different data systems and practices. So I think it's a concept that can sometimes feel a little bit amorphous that we hear about a lot, but so I want to hear, I'd love to hear from each of the speaker presentations, what's one change that you would want to see in data systems or practices that would better align with data sovereignty? Anybody want to start?
I guess me. Hi. So, I mean, I'm going to say this probably 3 times during this panel session, governance. We think that more tribal communities should be involved in governance processes. Ultimately, right, that how do we know and who decides question is the best way to ensure that tribal data sovereignty is respected. And I think that the sort of on the back end of that, and someone mentioned this earlier, right? Reporting and dissemination is not the end, right? We really like to think about the cycle, because what information can we give back and how does that help inform future agendas? And are we giving it back to tribal communities in ways that are meaningful to them? I think access is another big one. A lot that happens is people sort of, again, mine data, right? And then they take it and they hold it. We call this like a data mausoleum, right? It kind of just goes to die. And that's not productive. That's not beneficial for the people who have given over very valuable information. And governance processes really, they also can create trust, right? There's a lot of mistrust in this space, again, with Black and Indigenous people in particular. So what are they getting in return for that? How are we building that person-to-person trust? And how are they feeling control when they're giving up information? Because as we've discussed, a lot of places are not going to have the resources to do that work necessarily themselves. So how do we give them voice in that process as we start to build their own capacity?
Yeah. Yeah, I really love that. And I would echo the importance of engaging leaders and community leaders in the process of data collection, of evaluation, and reporting. Something we do in our needs assessment that we're doing with Fort Defiance right now is engaging folks as early on as possible. So we have this really cool tool at Mobile Health Map, and we provide that data to the Tribal Mobile Health Program, in this case, Fort Defiance, and ask them, what they want to do with it and how can we support you do what you want to do with it. So that really mimics the way that we approach our needs assessments and evaluation. But I think just engaging folks as early as possible, especially like you said, a lot of times we have technical assistance coming in from, outsiders coming into these communities. So how can you really engage the experts and allow space for leaders to guide the process?
I think to tag along that too, kind of like Isabel said, was the accessibility, right? Like at the National Center, like providing that case reporting tool, which is a free resource for that information to go into, is really helpful because you can have reform from that when you have the data and the information. One thing I kind of ran out of time during my presentation to talk about too is like, it's great to have all that data, but then what, right? So one of the things that we offer too is, the technical assistance is free of charge. So we're able to travel and come to you and provide that training, whatever it may be, unique to the tribe, but also the data visualization. So we have like a Tableau dashboard that's free of charge. We're able to get real-time data based on what you decide or not decide to put into that case reporting system, to pull up really pretty visuals and graphs if you don't have an EPI or, whatever the FTEs might be for providing that staff, is being able to have resources to real-time data and looking at the visualization part. So really getting that online accessibility, but also like printed versions, or having, we have a full data team here at the National Center that can help pick up the lift for those needs if needed. So.
Thank you. Yeah, we can take questions from the audience. Yeah, go ahead.
Hi, I'm Heather Zimmerman. I'm from Montana, and I actually have two questions. First, for the mobile health maps, I am wondering, like, obviously you're focused on mobile clinics, but I'm wondering if you've thought about interfacing with rural clinics that aren't mobile, but still sort of serve the same kind of need, and how that might look.
Yeah.
So that's my first question. Should I just jump in? I'll wait for my second question.
Yeah, that's a really great question. We're specifically focused on mobile clinics and street medicine, but we do leave some flexibility in there for how care is delivered. That's really just the means of bringing care into the community is what we look at, and what we like the requirement for a program to be part of our network. I wish we could expand, and I think that's something that we'd maybe like to do in the future, but we are focused on innovative care models that really bring care to the community in some capacity.
Did you want to do your second question?
Sure. So my second question is, it really applicable to anybody, but I was thinking about it with the mortality review. So Montana is a low population state. We have several tribes, but all of them are very small populations, and thus have, thankfully, relatively small numbers of child deaths to review. And I'm just thinking about, if every tribe had a review panel, it would be a lot of infrastructure for not much data. Mm-hmm. And I'm just wondering if you have ideas about how we could focus individual tribal control, and also not using so many resources. Yeah.
Yeah, I think Montana is unique, right? Because it's more fetal, infant, maternal, mortality. They do it all in one review. So I think that's a great example, is the state itself kind of combining different reviews across the different web of reviews, right? And it's all one team. So they're all throughout the state, but they're also, since there are smaller numbers, they're able to look at, fetal, infant, child, maternal, all across the board, but they're coming to review at one time. So I think your state itself is a great example with that. But I also want to point out too, like, even though it is or small numbers, those voices still need to be heard. It might only be one review a year, maybe one or two. Sometimes, things that can come into play is like those virtual meetings, or like maybe inviting a tribal member to come to a review for a specific case. Like if it's a tribal death in their community and they're, that Native voice wants to be included in the review, is maybe fostering that partnership with the review team that already has multidisciplinary people around the table, but bringing in like that specific Native voice could be one of those avenues as well, because I mean, even though they're small numbers, they're extremely important and those voices need to be heard. So I think, small numbers aside, it's equally important. But like you said, resources make it really hard, right? You don't want to put all of these people together, have this team do, extensive training and technical assistance, and then use them once a year. Like that's really hard to do. So that's one of the barriers that we face, and we've seen it, but there's quite a few examples, Montana being one of them, of combining the web of reviews, combining different ones into one team. So
I see a question back here.
Hello, good morning. Good morning. I'm Benita McCarn, and I work at Urban Indian Health Institute in Seattle, Washington, a division of Seattle Indian Health Board. And my question is for Caitlin and Elisa. Thank you so much for your presentation and just recognizing the crucial role of mobile health clinics in reducing geographical barriers and increasing access to care in these remote areas, and sometimes even not remote areas. I've seen this in Chicago as well, just having mobile mammogram clinics and things like that. But I'm wondering how people served are integrated in the evaluation beyond the point of care data. And then how are these findings and learning shared back with community?
Yeah, that's a really great question. And I want to reiterate, this is just one of the resources and tools that we provide to mobile health programs. And a lot of programs, especially tribal mobile health programs, are very short on staff. And so it comes to like prioritizing, what are we going to do for evaluation? And this is a good place to start when just looking for something that you can write in a grant application, for example. But we provide TA and work really closely with other mobile programs on specifically developing an evaluation plan that brings in community leaders and community voice. I'm an anthropologist by trade, so I'm really big into qualitative data and storytelling. So that's something we always bring into our work. And I'd say it depends on every program on how they report back their data, but that's definitely a piece that we always carry into the process and really allow the experts and the community leaders to guide that evaluation process. Definitely going to be taking what we learned in the first session about viewing dissemination in a way to continue conversations. So I'm really excited about bringing that back to folks. But it depends. I know it's not the best answer, but I think every organization and program is different, and we want to engage their community in a way that's the most helpful.
Hi, I'm Nicole Arthen. I'm a nurse midwife from New Mexico in the Navajo Nation. I noticed that you guys don't do any prenatal maternal health care for mobile clinics, and that's becoming really popular in other states. Is there any implications for that moving forward?
Yes, we would love to get into maternal care. It is something that's so important in prenatal care. We're looking for funding. So we are a nonprofit, so all of our work is grant, philanthropic, and federally funded. So hopefully we'll have the opportunity to really develop and stretch out our algorithm to account for that kind of care.
Yeah, well, there's still lots of data that Native women are not accessing prenatal care in the first trimester. So it would be a great opportunity for them to engage in their community.
Yeah, absolutely.
We used to have a women's health clinic with our program, but once COVID hit, it kind of went down because of the providers, where we don't have enough providers out there to come on board for the clinic. We lost a lot of our, some of our midwives that used to do that for us. So hopefully in the next year or so that we'll be able to bring them back on and then we can do that. We used to do that probably that once or twice a month, that we used to go out to the community and have a clinic like that. So we're trying to work on it. Thanks.
This is just a follow-up kind of comment about in Montana with the rates of death amongst our infants and fetal and maternal health, right? That although Native people are a small number in the state of Montana, we're disproportionately represented in our deaths. So like in our sudden unexpected infant death, Native babies are the highest, they carry the highest burden represented in that group for death. So again, there's issues with misclassification, which I'll be talking about tomorrow, but it's not just small numbers. I mean, I come from a community where we have deaths every week. Our tribal health system shuts down, our community tribal group, we shut down like for a day or two, almost every single week because we have deaths in our community. And it's because we're not captured. Our deaths are not captured correctly by the coroner, the medical examiner, who happens to be usually a sheriff. And so there's all these interesting complex interactions happening, especially in rural areas. It happens in urban areas too. I used to live in Seattle. I currently live in the San Francisco Bay Area. Definitely happens there as well, but definitely with surrounding communities that have been geographically isolated and resource isolated, we have these very interesting problems. So just more of a comment.
A number of folks have alluded to this, but in some of the communities that I work with, the data don't always reflect their lived experience, especially when there are gaps in the data or small sample sizes. And I'm wondering how your platforms bring in lived experiences and qualitative data. I know Kate alluded to that a little bit, but I'd just be curious on hearing some elaborations.
Yeah, I will just say that we work with a bunch of different network sites across the country, and each of those sites brings in qualitative data to the extent that it's relevant to the work that they do. I will lift up, and we did have someone from the Albuquerque, oh my gosh, AA-STEC is the acronym. Dr. Mingong spoke earlier, but they did this incredibly interesting work where they oversampled certain schools in their epidemiology survey so that they could have sort of larger numbers and unpack that lived experience more. And as such, they could also give more granular disaggregated data because they had higher numbers. It didn't have to be suppressed. I mean, the easiest thing to do is to collect and trust the data of lived experience as much as possible and treat that as equal and do that storytelling work. And I think in the meaning making process, right, especially if you're looking at more quantitative data, going back to the community and asking them what they think those results mean as you start to do that analysis. There's actually also some very interesting resources on tribe-specific analysis methods that are more sort of indigenous is maybe the wrong word for it, but are more sort of endemic to their community and their ways of understanding.
I think for the National Center, that quantitative data, right, that's all captured in that case reporting system and analyzed and used for lots of purposes. But in terms of qualitative, one of the aspects we see is through storytelling. A lot of the state reports, jurisdiction reports that are coming out, they include a story of a child that might have impacted the community in a major way, and just really putting like the life back into the work that we do, reflecting back on what happened and the impact on that community. So I think storytelling is one of the great ways that you can really look at it qualitatively.
Yeah, we also bring in a lot of storytelling in our evaluations to supplement the impact tracker data. We utilize interviews, focus groups, but also just casual conversations with patients on the mobile unit. Obviously, we ask for their permission to engage in those conversations, but it's something we're embarking on at Fort Defiance, which I'm really excited about. So just utilizing and leaning on the trust that already exists between provider and community members to really bring in that lived experience and story.
Hi, thank you for that presentation. It was really inspiring. And I wanted to ask more of a comment, but what you were saying, you were looking at innovative care models, and I was wondering if you looked at Cuba, because what you're doing with the vehicles seems really aligned with what they do, which is their health system is geographic. So they're like, for a poor country, they have 100% health coverage because they make sure in every zip code, medical care teams go through that zip code. And so it seems perfectly going together with what you're doing. And so maybe you already thought of it, but I was curious if you did.
No, I haven't. Our map is actually a world map. On our screenshot, it zooms in, so I should have zoomed out. But I haven't had a chance to look at Cuba, so I'm excited to explore that more. But we totally recognize and completely recognize that mobile health has been around forever of bringing care to communities, and it's not an American invention. So yeah, we definitely highlight programs around the world, and I'd like to talk to you more. That's so fascinating, and yeah.
Yeah, they have amazing outcomes for a place where I went there for a medical tour and we had to bring medical supplies and like aspirin and masks and gloves because they really don't have supplies or funding or infrastructure as much, but when I was there, they had zero mother to child transmission of HIV and different like outcomes that were amazing.
Yeah.
So just if you are looking for more care models, theirs is pretty cool.
Yeah, thank you.
Hello, my name is Zufran with UCLA. Thank you for all your work. We've noticed in our work that sense making is a productive activity. There's lots of barriers to accessing this data. A lot of the barriers have to do with people's ability to analyze data, which is not everybody's at the obvious that we work. A lot of the most important community wisdom lies in the minds of the individuals who are most impacted by the issue being trying to be addressed. And then a lot of the tools to analyze and collect the data are very difficult, as you heard with the CMS data sets. So I'm wondering if you folks have your work, by the way, have you thought about helping communities understand the use of artificial intelligence to reduce those barriers and increase the access to the data so that everybody involved can participate in that assessment process, so that policies are generated by the wisdom of the communities that we're mostly happy about.
Yeah, artificial intelligence. Wow. We also, in our data lifecycle, our initial one was algorithms and statistical tools. We have updated it to be specifically artificial intelligence and algorithms, which if you're a nerd about things like this, you know that artificial intelligence is just sort of a higher level algorithm, right? So the big umbrella is that AI is this beast, and it comes with a lot of different facets. I think the big thing is, of course, it should be utilized in the ways that it is productive, but also we need to be doing a lot of very careful thinking about what is it reinforcing. You don't want to be contracting a black box. A lot of algorithms are proprietary, and so these learning devices, we don't know what data they're scraping. We don't know what it's trained on. Often getting training data sets themselves can be incredibly expensive and burdensome and can be barriers to communities. What is that training data? Will it be functional? So I think, yes, it can provide a lot of really fantastic results for people. I think we just need to be very careful about whether or not it is doing that, or is it reproducing harm. AI also, a lot of the tools that exist tend to be deficit focused. We tend to be an asset focused organization. We really don't want to be reinforcing those negative stereotypes on communities, especially when we're thinking about Indigenous health, as was mentioned earlier. Reservations tend to have this sort of stigma around them as having all of these sort of health deficits, when we should really be looking at all of the sort of versions of community care and traditional care that is practiced there, and how can that be leveraged toward helping health outcomes. So capacity building is an issue, absolutely, and I'm just, we are very much people first, and what can we bring people in to do, and how can we build that capacity? If AI can be helpful in that process, I think it absolutely should be. I would also be remiss if I don't mention, and I'm sorry, I'm an evangelist for this, but the hardware behind AI takes up incredible resources. The amount of water that has to go toward those server farms, and I just think, especially as we're talking about people with such a connection to the land, I am really remiss to use that uncritically, just because of the resources that it takes up. I'm sorry if that doesn't entirely answer your question, but you brought up the 10,000-pound elephant that sits on my chest. Did I get close to it? No.
Why I bring it up is that, again, the access barriers are real.
Yeah.
It's very difficult to expect communities to be able to speak with a lot of statistics that they do not understand. Very few people understand it very well, right? And so by leveraging existing technology, I think that there might be an opportunity there. And I think that your particular agency is critical in the development of integrated data systems. And so being that, I know that it's something that you're trying to address. We'd love to talk to you about something that we're doing. Because I do believe that there's something about shifting power, ways to be thoughtful about engaging folks to shift power. And so as long as you're training your AI models to do that, then I think that you might be able to navigate through some of the difficulties. The other thing is that there is a lot of traits as it comes to artificial intelligence, and I wouldn't want this particular community to be on the back heels of it when there's an opportunity for them to be on the toes front, to be spirit, if you will.
Yeah.
And so and that goes to this other part of it, the governance. So we're learning now always have governance structures that would support that. In communities where we work, there's many tribal communities and there's many existing federal and government agencies. Just want to say that I worry that when we say data sovereignty, that we might be leading people into false understanding that they might have ownership, control, access, and possession of their data, when in reality, a lot of those data sets are owned by and controlled by other people. And then so what we're trying to do is we're trying to look for governance, indigenous data governance as more of an honest discussion of the issue, so that we don't provide false hope for people to presume that they're gonna census data that right. And so given that these polycentric governance structures might be really help address some of the key challenges. And again, I only bring that to you because obviously you are the 400-pound gorilla when it goes. And so meaning that I think that you're in a very privileged position to be able to help guide people through a process of understanding the power of these new technologies.
Yes, and absolutely. Just to be super brief, and I'm happy to talk about this on this offline as well. But yes, I'm not anti-AI. I think that it is an incredible tool and it can be very powerful. I don't want us to trick ourselves into thinking that it is already doing that, or that it's not, or that it is some sort of wonder drug. It's not. That being said, I do think that it can do wonders for democratizing data processes, and the fact that you can kind of speak to a computer in English is really powerful. And what goes with that, right, is that AI governance is a big one, right? The Cherokee Futurists are doing some work. It is not super online, so I don't know where they're hiding, but I have heard tell that they are doing some AI work sort of in the tribal context. But yes, and when we talk about data sovereignty, I'm so sorry. When we talk about data sovereignty, we should also acknowledge that, yeah, there are a lot of entities that collect tribal data that the tribes don't actually have ownership of it. And so that sovereignty is kind of hard to parse, right? And so how do we create transparent understandings with them.
Thank you so much. That's all the time we have. I know there were still some questions, but I hope you have a chance to talk at lunch. So if you'll help me thank our speakers one more time.